happy Friday. I hope your week is going well. In today's Q&A, I'm going to touch on a topic that I've gotten many questions about over the years since putting out many of my hair care videos, and that is, can I talk about the role for low-level laser light therapy and low-level laser light devices in the treatment of thinning hair and hair loss. So that's what I'm going to cover today. Low-level laser light therapy is something that you may have seen advertised on TV. You may have heard about it from your dermatologist, and you're wondering, is it something that is evidence-based and can it be helpful to you, and what are the side effects? I've gotten questions about this over the years. So low-level laser light therapy, what it is it is a safe form of light therapy that can be used to stimulate hair growth in men and or women with a specific type of hair loss that is very common, and I have videos talking about, and that is something called pattern hair loss, male pattern hair loss, female pattern hair loss. This is also called androgenetic alopecia, and the genetic in that underscores the fact that this has a tendency to occur with some sort of genetic predictability, some sort of genetic association, I will say, not predictability, that was a poor word choice, but there appears to be a genetic association with this. In other words, if you have somebody in your family who had pattern hair loss, there's a chance that you may develop it too. It's incredibly common. It occurs in 70% of males and about 40% of females at any given time in their adult life. And in men, it classically presents as thinning of the hair and balding at either the vertex of the scalp, so here, the bald spot, and or receding hairline. So you're probably familiar with this. But in women, it often can be similar to that. They can have a receding hairline, but more often than not, in women, pattern hair loss presents as diffuse thinning of the hair and a widening of the part, of the central part. So in other words, if you photographed the top of your scalp, years and years before the onset of the hair thinning, that line down the middle would be much thinner than it is now. It's much wider now. You can see more of your scalp. So that is typically how it presents in women, just as diffuse thinning. But regardless of if you're male or female, pattern hair loss is an incredibly frustrating condition to deal with. And standard typical treatments, which I also have videos on, include over-the-counter minoxidil, which goes by the brand name Rogaine. I've talked about this in other videos. It's something that has to be used consistently. Its side effects are dryness and irritation. So, and when stopped, you often go back to the level of hair loss that you had from the beginning. So check that video out. But minoxidil is standard care for this, but can be obviously frustrating, and a frustrating part of treatment, having to use something on a daily consistent basis. The other treatments include the medication finasteride for men, which I have a video on, or Propecia, as well as spironolactone. It has some variable efficacy in pattern hair loss in females. And then, of course, the most expensive kind of, intervention is a hair transplant, but definitely an option out there. And low-level laser light therapy has emerged over the past few years as a safe safe and effective treatment that can either be done as an alternative to these standards, or to these standard treatments, or in addition to those. Low-level laser light therapy, like I said, is safe. It was first reported actually in mouse models in the 1960s to trigger hair growth in mouse models in the lab. And outside of the lab models, we also have observed what's called hypertrichosis, or hair growth, as a side effect to other light treatments or diseases that involve photosensitivity to different wavelengths of light. So specifically, we have observed an unusual adverse effect of laser hair removal sometimes can be paradoxical hypertrichosis can occur. which just means excess hair in other areas. And we've also observed this with treatments that are called something called PUVA therapy, which is a type of phototherapy using a very select wavelength of ultraviolet light in a calculated dose. And sometimes we have observed as a side effect hypertrichosis. And then lastly, there is a condition called porphyria cutanea tardae. It's a type of photosensitive disease where patients have photosensitivity and a variety of other skin and systemic findings. But suffice it to say, in addition to the rashes they get, patients with this photosensitivity, they also get hypertrichosis. Low-level laser light therapy actually can stimulate something in the cells in the hair follicle called cytochrome oxidase. And what this then results in is an increased production of ATP, which is the energy currency for the cells in the hair follicle. And this results in increased cell proliferation and re-entry of the hair follicle from the resting dormant telogen state to the growing phase, the anagen phase, which is what is the core issue in male and female pattern hair loss, is that the hair prematurely goes quiet and turns into a mini baby hair, and as a result you have balding on the top. But the light is thought to stimulate things back to the growing phase. Additionally, it's also been shown to influence the the expression of growth factors and genes needed for the re-entry into the growing phase. Low-level laser light therapy uses red light, and also can use infrared radiation as well. So both of these have been examined in laboratory studies as well as clinical studies, and have been shown to be helpful in improving the density of hair growth. In terms of low-level laser light therapy, what kind of benefits have been observed in clinical studies? There's a randomized controlled trial that I can give you as an example. I'll list my references down below for you guys, by the way. But a randomized controlled trial that comes to mind that was double-blind of 110 men, I believe, with male pattern hair loss. They were randomized to receive a low-level laser light therapy with a device, or as a placebo to the other arm of the study. The other group of men within that 110 received what's called a sham device. So just a cap, or just a comb, just a cap that had like regular light bulbs in it, just sham bulbs. So these men had an increase in hair density after 26 weeks of twice weekly use of the low-level laser light therapy, and they also had an increase on average. This is pretty striking. So the researchers actually counted the number of normal hairs per square centimeter of area in the treated area, and these individuals had on average an increase in 19 hairs per square centimeter of surface area, whereas those in the control group had a decrease on average of 7 hairs per centimeter squared. Additionally, subjects report improvement in thickness and in shine of the hair, overall health, and improved quality of life. So suffice it to say that low-level laser light therapy is definitely an option, either as an alternative or as an additional treatment for male or female pattern hair loss. And it has many advantages. It's low cost. It is portable, meaning you often can take these with you if you need to go on the road. It's something you can do at home. It doesn't involve actually a huge time commitment. And as little as anywhere from 8 to 16 minutes twice a week can result in improvement in the hair growth, hair density. There are a few low-level laser light treatment devices that are FDA cleared, that are on the market, that are effective and do help many people. And the way to use them, it varies a little bit depending on the device, but for the most part, you wear the device anywhere from 8 to 16 minutes, 2 to 3 times a week. And you start to see benefit actually as early as 16 weeks for some people, but anywhere from 16 to 26 weeks. And this can be paired alongside, after you wear the device, you can massage the scalp. Sometimes there are some scalp oils that are included that can be massaged into the scalp after using the treatment. And that's thought to kind of help in stimulating the growth factors to enhance the outcome. And also condition the skin of the scalp, and also condition the hair follicle, the hair shafts, that are already there, to just help in overall hair health.